Oxidative cancer therapies. What are they? There's a lot of confusion, I think, out there around oxidative cancer therapies. When you look at the counter to that, it's antioxidants. There was a recent study looking, not a recent study, it was a recent press release, it was masquerading as a study, that looked at multivitamins, and they said that these antioxidant therapies provide no benefit in cancer. And I would tell you that there's a lot of truth to that, but we're not talking about antioxidative dosing. We're talking about oxidative or pro-oxidative dosing. So when we talk about antioxidant and pro-oxidant, we're talking about a buffering system, essentially an exchange of electrons. Just as we talk about pH, whether it's acidic or alkaline up here, acidic down here, is the body buffers. It has a certain window that it needs to exist in. Likewise, that exists in the electron exchange system. Think of oxidation as that car sitting out in the weather and it gets rusty. It still looks like a car, but that rust that you see is the visible effects of oxidation. So anything that generates oxidation is pro-oxidative. So when you look at this, the perfect example of pro-oxidative or oxidative therapy is vitamin C. Now, back in the late 70s and 1980s, there was a misunderstanding that generated a narrative that lasted for now 40 years. That's just wrong. Vitamin C, when dosed IV, is pro-oxidative. It's oxidative in cancer cells, but not healthy cells. Yet when you give vitamin C by mouth, because of the altered absorption of the gut and the poor bioavailability, pharmacodynamics, and pharmacokinetics, oral vitamin C, as was looked at in the Rochester Mayo studies in 1978 and 1985, they said, look, there's no anti-cancer benefits. Well, it's because what we now know, which they should have known at that time, is that oral vitamin C had different pharmacodynamics and pharmacokinetics. And this generated an antioxidative approach. And this recent press release said, hey, multivitamins, particularly vitamin C, they're not going to provide a lot of effects in cancer therapy, so we don't advise it. Well, yeah, that's if you use it orally, antioxidatively. But if you use high-dose vitamin C IV and use it pro-oxidatively, guess what? You have a completely different picture of effects. It can be directly cancer-killing, immune-stimulating, and augmentative to other cancer therapies. That's the power of actually taking something and using it right, and using it in a way that the evidence guides to deliver it. But vitamin C is not the only oxidative or pro-oxidative therapy that we use here at Brio-Medical in a precision cancer care treatment program. Hydrogen peroxide. Hydrogen peroxide is generating a pro-oxidative or oxidative effect. In fact, vitamin C, it's now felt in research, its primary effect is in generating hydrogen peroxide in both the tumor microenvironment that then passively diffuses into the cancer cell. Other examples are ozone. Ozone is a very powerful oxidative therapy. So these are just a few examples of how we can, through electron shifting and promoting of imbalance of that in the cancer cell. Now, this is the great part. This can be in the cancer cell and the tumor microenvironment, yet this pro-oxidative effect doesn't occur in healthy cells and healthy environments. It's recognizing how to target the tumors in precision cancer care, but heal the body at the same time. That's what a oxidative or pro-oxidative precision cancer care program looks like for you here at Brio-Medical. I'm Dr. Nathan Goodyear, Medical Director here at Brio-Medical in Scottsdale, Arizona. To learn more about your customized precision oxidative cancer care treatment program to target the tumor and heal the body, I encourage you to go to our website and learn more information there. I look forward to talking to you or seeing you soon.